How to get doctors to understand your seronegative RA. To help doctors understand your seronegative rheumatoid arthritis, it is essential to communicate your symptoms clearly and highlight the diagnostic challenges. Seronegative rheumatoid arthritis means that you do not have the typical antibodies, such as rheumatoid factor and anticyclic citrullinated peptide, in your blood. However, you still experience the joint inflammation and other symptoms characteristic of rheumatoid arthritis. Start by describing your specific symptoms in detail. Talk about joint pain, swelling, stiffness, and redness, especially if it affects multiple joints on both sides of your body. Mention if you experience morning stiffness lasting more than 30 minutes. Describe any persistent signs of inflammation, like warmth around your joints, and include systemic symptoms such as fatigue, weakness, or low-grade fever. Explain that seronegative rheumatoid arthritis can be harder to diagnose. Blood tests for rheumatoid factor and anticyclic citrullinated peptide may be negative, even when the disease is present. Emphasize that diagnosis often relies on a combination of factors. This includes physical examination findings that show joint inflammation, imaging tests like X-rays or ultrasounds that reveal joint damage or synovitis, and elevated inflammatory markers in blood tests, such as erythrocyte sedimentation rate or C-reactive protein, even if the antibody tests are negative. Highlight that seronegative rheumatoid arthritis is a recognized subtype of rheumatoid arthritis. Many patients with this condition have symptoms and joint damage similar to those with seropositive rheumatoid arthritis. Some patients who are initially seronegative may develop antibodies later, but many remain seronegative throughout their disease. Encourage doctors to consider seronegative rheumatoid arthritis, especially if your symptoms align with rheumatoid arthritis but blood tests are negative. They should also rule out other conditions that may present similarly, such as viral arthritis, gout, or spondyloarthritis. Early diagnosis and treatment with disease-modifying antirheumatic drugs are crucial to prevent joint damage and disability, regardless of antibody status. In summary, to help doctors understand your seronegative rheumatoid arthritis, provide a thorough and accurate description of your symptoms and their impact on your life. Advocate for a comprehensive evaluation that includes physical exams, imaging, and inflammatory markers. Acknowledge the limitations of antibody tests in diagnosing seronegative rheumatoid arthritis. Stress the importance of early treatment based on clinical findings, not just blood tests. This approach aligns with current medical understanding that seronegative rheumatoid arthritis is a legitimate diagnosis based on clinical and imaging findings, even when standard antibody tests are negative. It helps ensure that your doctors see the full picture beyond blood test results and manage your condition appropriately.